my name is Autumn Wynn Pichardo, and I chose to do my research project on maternal deaths in the United States. I chose this topic because over the years I've heard quite a lot about maternal deaths in the United States and how they are abnormally high compared to maternal deaths in other first world countries and developed countries. And then over the past few years, I've heard a lot about some racial disparities when it comes to healthcare in general and maternal deaths specifically. So, just to start off with, I want to just state what is actually classed as a maternal death because it's a lot wider of a range than I expected it to be. So, per the CDC, maternal death is a death occurring anytime during the pregnancy itself and up to 1 year postpartum. So, on this slide, I have it broken down into three different sections where 31% of deaths occur during pregnancy, 36% of deaths occur during birth or the week after, and 33% of deaths occur between 1 week and 1 year postpartum. So they're all very evenly spread out amongst the different time frames. And now on this slide, I have a graph from the CDC as well that illustrates the rates for different countries and the rate of deaths per 100,000 live births. So the country that's doing the best is Finland with just under 8 deaths per 100,000 live births, which is very good. And then the next highest besides the United States is the United Kingdom, and they have just over 9 deaths per 100,000 live births. And then there's a huge jump from that, over 2.5%, to the United States, who has 26.4 deaths per 100,000 live births. And then if you look at this, you'll also notice that the United States is the only one on this list where our numbers are increasing pretty steadily, and they've increased quite a lot since or between the years of 2000 and 2015. So, what are the major causes of pregnancy-related deaths in the United States? This is broken down from during pregnancy, day of delivery, 1 to 6 days postpartum, 7 to 42 days postpartum, and then 43 to 365 days postpartum. So during pregnancy, the most common causes of death are non-cardiovascular medical conditions, other cardiovascular conditions, and infection. During the day of delivery, the most common causes of death are hemorrhage, amniotic fluid embolism, or cardiovascular conditions. Then the following week, so 1 to 6 days postpartum, the most common causes of death are still hemorrhage, and then hypertensive disorders of pregnancy and infection. And then from 7 to 42 days postpartum, the most common causes of death are infection, other cardiovascular conditions, and cerebrovascular accidents. So those are going to be your strokes. And then from 43 to 365 days postpartum, the most common causes of death are cardiomyopathy, non-cardiovascular medical conditions, and cardiovascular conditions. So what are the factors affecting maternal death rate in the United States? There's many different factors, from patients to community factors to provider and systemic factors. So on a patient level, the patient themselves, it's their socioeconomic status, their race and ethnicity, and then the patient's own beliefs, behaviors, and genetics. So then we have community factors, and those include social networks, housing, support systems, and transportation. And then there's provider factors, and those include the provider's knowledge or sometimes the lack of knowledge, implicit bias, and communication. And then on a systemic level, it includes the access to high quality healthcare, structural racism, which is unfortunately still a thing that we're dealing with in 2020 in the United States, social and political policies, and healthcare institutions. So while I was researching all of this, I was very surprised to see that 1/3 of all pregnancy-related deaths in the United States, so 60%, are very easily prevented with just better healthcare, communication and support, stable housing, and transportation. So it was very concerning for me to see that even though those are such simple fixes for such a big problem, that our rates continue to increase every year instead of decrease like the rest of the countries that I was looking at. So, this is something that I was very interested in coming into this, and that's the racial and ethnic disparities in pregnancy related deaths. When it comes to white non Hispanic women, the rate of death is 13 deaths per 100,000 live births in the United States, and there's a very big gap between that and minority women. So, for Native American and Alaskan Native women, they're dying at a rate of 30 deaths per 100,000 live births, and an even bigger number for non Hispanic black women in comparison to white non Hispanic women. It's 42.4 deaths per 100,000 live births. So that's 3 to 4 times the rate for black and native women as it is for white women in the United States. So, what is actually being done about pregnancy related deaths in the United States? Many hospitals and healthcare systems are starting to implement new guidelines and safety protocols to try and reduce the risk of maternal complications and deaths. And then the state of California had what was called the California Maternal Quality Care Collaborative that launched in 2006, and that amazingly decreased the rate of maternal deaths in the state of California by 55%, which is a huge number. However, once they started to look into that, they realized that it did very little to decrease the rate at which minority women were dying. So that was still a major issue, and it still is a major issue. So because of that, they launched another group called the California Birth Equity Collaborative, which is partnering with Black women-led community groups to address the persistent inequities. So on a federal level, Congress formed the first Black Maternal Health Caucus in 2019, so that was very recent. And in the year before that, they passed the Preventing Maternal Deaths Act of 2018, and that is directing more funding and federal resources to collecting data on maternal deaths. And then on top of that, the federal government currently for Medicaid, women get 60 days of coverage postpartum. So the federal government is working to extend that 60 days of coverage to 1 whole year postpartum, which would be amazing because that would allow the mothers to get the health care that they need after they give birth. And now this is some information that I got from the American College of Obstetricians and Gynecologists. They also noticed the disparity when it comes to white women compared to minority women, and they issued a list of proposed solutions. So number one on that list was that diversity is needed at all levels of the healthcare system, which I think is very important. They also state that healthcare providers must acknowledge the role that they play in perpetuating healthcare disparities. So, any healthcare provider needs to be able to self reflect on themselves and see whether or not they are contributing to the healthcare disparities or if they're helping the situation. And then, on top of that, for healthcare facilities and providers, they state that they need to educate staff and colleagues about community resources for women with limited access to healthcare. So it's important for us to know those resources so that we can tell women what their resources are so that they're also informed and are able to make their own decisions when it comes to their own healthcare. And then lastly, they state to work collaboratively with local public health authorities to address disparities in environmental exposures, health education and literacy, and women's health services and outcomes. So, in summary, maternal deaths in the United States are classed as a death occurring from pregnancy up to 1 year postpartum. And there are many, many factors that go into pregnancy related deaths in the United States, whether it's on a provider level, a systemic level, or the patients themselves. And all of these things kind of need to work out together in order to start decreasing the rate of maternal deaths. So hopefully by 2030, we can start to see some sort of decrease in the rate of maternal deaths in the United States. So, thank you for watching my presentation. Hopefully, you learned a little something. And that was all. Have a good day.